Hello, my name's Katherine Cox. I'm an ST7 in paediatrics based in Edinburgh. I'm here to tell you a bit about the research and scholarship domain of the new Progress curriculum and how this relates to the work that you may do. When the Progress curriculum was developed, it was clear that each element of it should be applicable to all trainees and achievable by all trainees. How does this relate to research when many trainees may feel that they do not do any research? Well, the domain is not about having publications in leading journals. The idea is that everyone will understand what is involved in research and will take this as far as they wish in developing their own interests in their career. One area where we all use research in every day of our careers is when we look at guidelines. The guidelines we use, if they're to be validated, must be research based. You may be involved as you go through your career in writing your own guidelines, and this involves evaluating evidence, collating it and putting it together into a worthwhile guideline which can be used by colleagues or further afield. Another area that we're all involved in research is in reviewing journal papers. Whether this is when we read papers for our own interest and assess whether we think that their work is valid, whether we may present it at a local journal club for our colleagues, or even you may be involved in peer reviewing papers before they are published at the help of your senior colleague. Finally, you might be interested in clinical trials that are happening locally or nationally. You might want to find out a bit about how these trials have been developed and become more involved, for example, in recruiting patients to these trials. A great starting point if you want to become involved in clinical research is the Good Clinical Practice course, which is run all over the country. This is a course which teaches about the ethics of trials, the basics of trial design, a small understanding about statistics and how this is relevant to interpreting trial results, and also gives you the tools necessary to recruit and gain informed consent for trials. It may be that having taken part in these activities, you discover a real passion for research and that you want to take this further in your career. By getting in touch with local interested paediatricians and other doctors, you might be able to gain experience and lead towards a period of research, perhaps as an out-of-programme experience, and this can be invaluable for your career. But this is obviously for the minority of paediatricians, and I would stress that it's really important that everyone has a basic understanding to guide their career, to guide their working day to day, and to help them to be the best paediatricians. And that's really what this domain is about.